right, so we're going to go ahead and get started with the webinar. I hope everybody's doing well. My name is Demario Atkins. I'm the CEO of VirtuAssist, and I'm out here in Richmond, Virginia, where the weather is up and down. It's very hot today, but it was rainy for the last couple of days. But this is going to be a pretty cool webinar that's going to really help out your practice. And we want to help you stop losing patients at the front desk. That's the title of this. Next slide, please. All right, so this is a part of what I want to discuss when their clients finally make the phone call. And I'll reference clients and patients, so I know that different practices use different terminologies when they are referencing their individuals that receiving services. One of our specialties with VirtuAssist is we work with all different types of medical practices. So we work with mental health practices, medical offices, dental offices, chiropractors, and et cetera, et cetera. So we work with a bunch of different practices. But we all together, we wait on the phone call in most cases. And when the client finally make that first phone call, they decide that's our decision to decide if they're going to reach our practice and become a client of our practice, or are they going to choose a different practice. So there are several different things that go in the mind of our patients or our clients before they make that decision. Next slide, please. So a little bit about me. So my main company that I have is called Behavioral Health Services of Virginia. We are one of the larger behavioral health practices in the state of Virginia. And what we experienced right after COVID was we were losing about $40,000 each month. And that was because all the costs, and we're still experiencing that now, but all the costs went up, including our payroll costs, which was the biggest cost that you can imagine that's on our sheet. And we were losing $40,000 per month. And what we had to find a solution. And that's when we found solutions through virtual assistants. And that was the day that we decided to open up VirtuAssist, because it helped out our company. And we wanted to help out other business owners in America, because at the time when I first found out about virtual assistants, I had no idea about virtual assistants. I thought it was only for big companies. And then the second thought that I had was that that virtual assistants wasn't, didn't work very well with different businesses. And I'll show you that it really helped our business. And now we are profitable. We're not losing $40,000 anymore because we made some changes. All right, next slide, please. All right, so the next thing that I want to talk about is you may not have a lead problem. It may be a problem with your front office. And we had to figure that out as well as an organization. Marketing sometimes cannot fix every single issue. I know that a lot of our marketing companies, they tell us, hey, spend more money, you may get better leads and all those different things like that. But sometimes we notice that when we put more money into marketing, that's more money that we're losing overall. So what we do is we want to make sure that you put people in place. So then, you're not contributing to that broken process of your response time. Next slide, please. So and this is how that we foresee that patients experience when the response time is not there, right? So the first thing is we know that each patient, they make a phone call. All right, if they don't get an answer, that moves over to the next thing. And then they start searching. And as we know that, we build our reputation. So when a client starts searching, they're going to look up through Google, different areas. And then when they finally call you, they are looking for that connection. So if they don't connect with you, that means that they're going to try to start connecting with a different provider. And, so say, for instance, you have 5 stars on Google, most likely they're going to try to connect with you first. But that doesn't mean anything if you don't answer the phone or you don't have someone to answer the phone. So from there, the client, because their legs is hurting, they're going to move on to another provider. And we don't want that to happen. So speed is not, it does not separate us from patient care. It's part of the experience. When our clients call us, they want to answer. When our patients call us, They want someone to answer them and show them exactly how it's going to help their pain point, which it could be a medical condition, a mental health condition. Next slide, please. All right, so one thing that I always talk about is we talk about hardworking staff, right? And when we think about hardworking staff, we think about those staff that come in early and leave late. But some of those staff that come in early and leave late, they are not effective at what they're doing. So, what I'm saying is sometimes when the phone is ringing, that means that there's still a patient standing right in front of them at the front desk. So then that person has to decide between answering the phone or handling that patient right in front of them. And then the second thing is the assurance verification. So again, they still have all those different people in front of them, and they have to make sure they verify the assurance. So assurance verification can happen in one or two ways. We can do it prior to the client coming into the practice, or we could do it right there while the client is right there in front of us. Ideally, I think we should do it before the client comes into the practice, but because that doesn't overwhelm the people that you have in your front office. But everyone, no matter what's going on, if they're on the telephone or they're right in front of you, they want an answer and they need an answer from us. But sometimes our team has a limited capacity, and that hurts your overall revenue. Next slide, please. All right, so a word that we don't want to hear in this industry, in the medical industry at all, is "we'll call you back." That's a terminology that hurts revenue overall. Sometimes it works though, in very limited cases, and that's when it happened quickly. So if they ask a very advanced question that you can't answer, such as, "Hey, I need to ask the doctor that question," that's understandable and that works in that type of situation. But if they're asking a simple question as far as, assurance, do you take my insurance? That should be a question that person on that front end should be able to answer. And also, people are looking for consistency and also a clear next step. Okay, I'm going to call you back, but I'm going to give you these clear next steps. But if it's not a complicated question, that drops trust. And you don't want your patients to lose trust within your overall practice. Next slide, please. And so another thing, as far as marketing, you worked very hard to create this opportunity. I will always say this: I would give every practice owner a pat on their back, because you worked very hard to create this overall opportunity. Because if you can imagine just getting one particular client, it takes a lot of work to do that. It takes marketing dollars and also changing in the marketing, because sometimes marketing needs to be changed over and over again. Building relationships, going to those lunches, doing those lunch and learns with different providers, telling them about your services, telling them about how you are able to be more innovative than their other referral sources or referral places they refer clients to. Also, provider availability. So we go back to saying, "Hey, we are available when you need me." That's part of when you are explaining and you're making promises to different referral sources. But how do you lose? The quickest way to lose a referral source is missing their phone call or missing their person that they referred to you, or phone call. Slow follow-up. Can you imagine giving them a critical patient and you're not calling back that critical patient for 2 weeks? That's unheard of, but at the same time, that happens sometimes in the medical industry. Also, incomplete intakes. So making sure that that the inner office is handling the whole intake process. So that's, we want to make sure that we are capitalizing on all the hard work that we put into getting that particular client, because no matter how big of a practice you are, you get clients one by one, and you want to continue to build those relationships to become a bigger practice and scale your practice. Next slide, please. All right, so the 1 week handoff can stop the entire journey. As you know, it started off with a phone call most of the time. When we think about medical practices, most medical practices don't have a person that's knocking at the front door unless you are urgent care. but they don't have people coming to the front door. Most people, they call to make their first appointment. And then scheduling. So making sure that we are able to schedule you as quickly as possible to get in for the services you need. Then the next step would be verification of insurance, making sure that your insurance is valid, number one, because we don't want to bring in a client or a patient that has invalid insurance. So verifying that. But then the next step of that is verifying that that's an insurance that we actually take for our practice. That's another important piece. And then also, depending on how your practice is set up, some practices prefer that the clients complete their paperwork prior to them coming into the office. Some do it right there in the office. I always recommend that, if I had to give a recommendation to any practice, they get that paperwork completed prior to them coming. And then also the last step that's most important is them actually showing up for the appointment. That's the entire journey of a client. And we want to make sure that you put people in place to help you with that journey. Next slide, please. All right, so the next thing is, what is your front desk really costing you? That's always the question, and a lot of times, most practices are not keeping up with this because it is an expensive cost to have your front office. I consider the front office as being the brains of the operation. Without a solid front office, the operation cannot work efficiently. And with the brains, as they are moving across, that particular department has to make sure that it's protecting the revenue. So number one, the employment cost. In most medical practices, because it's more of a doers type of industry, the employment cost is the most expensive line item on any reports that you look at, your financial reports. So wages, payroll taxes, benefits, leave, and also any equipment they need, computers, also office space for that physical person to be in office or working inside your practice. But other areas that cause a lot of leakage in the revenue is missed calls. Again, you paid for a lead for them to start working with your practice, but they missed the call, or you develop a relationship, missed that call. So incomplete intakes or no-shows. It's very important to call clients back to see if they are going to show up for their appointments. Eligibility and authorization and other issues that come up. But the other cost that I think is like one of the bigger costs is the leadership cost. Owner's time. How many times as an owner you have seen yourself doing administrative work, or even some of our owners, they are doing work that they hired several people to do, but they're right there doing it with them. Also, if you have a manager in place, the manager being interrupted on the front end office tasks, and they're chasing tasks. Also, the other part that hurts leadership is you should be working on items that's going to grow your practice. And that's what the front office is really costing you if you don't have a strong front office. Next slide, please. So this is where we talk about where do revenue leaks. So number one, let's look at insurance. So insurance, can you imagine? And I feel like this, and I may be wrong with this, but insurance companies are made to not pay out for the claims. And as providers, what we have to do is we have to make sure that all of our ducks are in a row to make sure that we are ultimately being paid by the insurance companies. Meaning that if you first verify the insurance and making sure that we're not providing services. So say, for instance, you don't take TRICARE for your practice, but then if you admit a person into your services that has TRICARE, that means that money is 100% uncollectible because you're not credentialed with that particular insurance company. So insurance is very important to make sure that those steps are being handled in the right way. And also, even when we talk about insurance, making sure that we are able to verify how much deductible the client will be responsible for that particular visit. No-shows. No-shows is a way that revenue leaks, because if that person does not show up for that particular session, you're unable to bill for that session, and you're unable to get any revenue for that session. And then also staff dependency. Staff, when they're depending a lot on the ownership to get a lot of the tasks done, or the managers or different things like that, that causes revenue to decrease. And then also owner overload. We see that our owners sometimes take on those extra tasks that because they feel like they have to, and normally what it means is it's not the right staff in place that makes that owner has to step in. Next slide, please. All right, so and insurance verification is really important to me, so I want to, hone in more about the insurance verification part of things, because as we all know, most of us, unless you have a bunch of self-pay clients, the insurance is the way that we get paid, and that's how we collect our revenue. So that's very important. So it's very important for us to verify those insurances before they actually come into to your office for their visit. Also, make sure that if there's any documents that need to be confirmed, that will be sent out. A lot of different services do require that prior authorizations are happening, so making sure those documents are filled out in the correct way, and also escalate discrepancies early. So if we're noticing any issues with insurance, we're escalating that to the appropriate party, which a lot of times it's the practice manager or the owner of the practice. Next slide, please. So part of what we want to offer to you is more administrative support. And the administrative support is going to protect your patients and your practice overall. And our goal is to make sure that you have assistants that's going to work within your agency and integrate right into your agency. Our VAs, what they do is they are trained on confidentiality, and they are aware of all the different practices for HIPAA to protect the clients, but also protect your practice. Also, you want to develop some standard scripts for them to be able to know exactly how to talk to the clients that's calling. Also, having rules in place for escalations when things are urgent and there's some clinical concerns, because we don't want someone answering the phone answering clinical concerns directly. Also, developing systems where you are able to do quality monitoring and making sure that the phone calls are happening in the right way, and also ongoing accountability. I think that's very important to hold every staff member accountable and keep them focused, because overall, your goal as a business owner is to scale your organization. And that's what we want to do. We want to help you scale your organization. Next slide, please. All right, so when we look at this right here, when I look at this empty chair, that empty chair means that that's an appointment that we cannot recover, because if they're not there, we're unable to bill for that particular service. The number one, if the provider was available, sometimes the practices have to pay for that provider. So now that's some costs that has to be paid. Some providers, they don't pay for missed sessions, but most of them do. The overhead cost was paid, so that means that client didn't show up. Our administrative team has already did some work for that client, such as making sure they fill out that the intake forms, verify insurance, and that caused revenue to disappear. And we know this. We know that every no-show is not preventable. We know that. We know that people sometimes still don't show up, despite us calling an hour before, and they say, yes, I'm on the way, and they still don't show up. But the idea is for us to reduce the amount of no-shows, and also with our services, we believe that we can pay for ourselves through these services and make you even more revenue. So next slide, please. So this is right here a part that I want to talk about as far as scaling. And part of scaling your organization, for me, let's go back to Behavioral Health Services of Virginia. Right now, we have about 10 VAs that work within our organization. But we started off with one VA that worked in our organization. But 10 VAs that work within our organization, and they have some particular tasks that they do to help scale our organization. One thing that I always say is one person should know every single process, but one person should not do every single process. Meaning that, number one, we have someone that's doing phone coverage. Number two, scheduling knowledge. Three, insurance workflow, and number four, patient follow-up. And if one person knows that particular job, we know that they're going to have sick days, they're going to have vacation, they're going to have turnover. So we have those employees sometimes that just walk out. But one thing that we want to offer you guys is consistency, because our VAs, they don't have a lot of sick time off, they don't have a lot of vacation. Also, turnover is very low within our industry. But if you can imagine that we grow your agency to a point where you need one person for phone coverage, one person for scheduling, and one person for the assurance verification and maybe billing, all those different things like that. That's what we want to do. We want to build a documented workflow that can really help scale your business. Next slide, please. All right, so the owner should not be the backup front desk. As owners, I think that that we all think that is a fun thing or a great thing for us to step in, because that shows leadership. But what it really does is it takes away time where you as an owner should be focusing on strategies, building partnerships with other providers, and also focusing on profitability. But while you answering voicemails or scheduling patients or chasing tasks, that's taken away from that time that's really needed for you to support the business, to see the business grow. Next slide, please. So our goal, and I want to just reiterate this, is we want to help you build a stronger front door. And through our services, we have helped a bunch of different businesses in the medical field to get to a stronger front door. And that's our goal, to help each person that's on this call right now. Next slide. So a stronger front desk, what did that really feel like for a provider? So, or what it feels like for a person overall. So number one, when we look at for the patient, the calls are answered more. Number two, it would be the next steps are clear for the patient. They know exactly what the next step is. And number three, follow-up happens on time. So if a provider say, hey, I'm gonna follow up with you on this particular date, it happens on time. For the practice, insurance is checked early, which is most important because we want to make sure we're protecting our revenue. Tasks are documented. And number three, internal staff can focus on what their job is. Next slide, please. All right, so the next thing is where you want to do is you want to add capacity where patients are being lost. And this will be something that we will talk about in your one-on-one meeting with one of our advisors, would be, what do you need to help the most? Because again, you don't want to lose revenue or you don't want to lose clients. So part of it is, do you need help with phone coverage? Do you need someone to answer those phones and say, okay, I'm scheduled you for this particular, for your appointment, and then also doing those follow-ups. And then number two, do you need scheduling support? Is that booking, rescheduling, reminding, or following up with patients? Number three, assurance verification, confirming and documenting eligibility information. That's the first step of a lot of the different processes. And then also the last step, if you really want to think about this, is, do you want intake follow through, making sure that your patients or your clients is filling out the intake forms, or are they filling out any of the documents that need to be completed before that visit? Because then if you realize that they didn't fill that out, that VA can help you put someone else in that slot. So then that provider has not missed that time or that slot that's been open, and going back to that open chair. So then you're not having those open chairs. All right. And if any of these items here, if you feel like you have a gap in these areas right here, type in the chat ready, because we want to know if you're ready for this. Next slide, please. All right. So so part of this is support your staff, and you do not want to compete with them. Sometimes what happens is, we know that practice owners and managers, what they do is they compete on who can work the hardest. It's better for you to support them and give them that support, because you want to make sure that the right people are maintaining the clinical judgment, the escalations, and on-site with the patients. And then us with VirtuAssist, what we would do is we will handle the repetitive administration, the consistent follow-ups, and also the defined tasks. So we can do that for you guys. Next slide, please. So this right here, part of our process of onboarding is very simple, and getting started with us is very simple. The first thing is you're gonna meet with a advisor within our team, and what they would do is they would assess to see exactly what your needs are. So they're gonna ask some questions. Okay, do you need someone to help with phone calls or this particular area? Because our goal is to make sure that your organization is growing. And then they're going to define with you as a team what responsibilities and what needs to be done. That's what we're going to do. Then the third thing that we're going to do is we're going to allow you to interview 2 to 3 candidates that will work with your agency. But they're going to be 2 or 3 candidates. You'll be able to see their resume, have a live interview with them, and determine if this is the right assistant for you. And then once you select the person that's going to work with you, the next step will be preparation. So you have to start preparing for that new VA or that new team member. We like to call them employees because they essentially will be another extension of your team. But the next step will be for you to prepare access for them. So any documents or any systems, SOPs, or anything like that you need to get them, prepared for, any scripts, any workflows that you have set up already, or any escalations, you'll be able to set that up. And then the last and final step to this is launch. So then you'll have your VA and they can start working with your company and start working with you. Next slide, please. All right, so I'm gonna ask you a few questions, and these questions would be something that you can kind of think about to yourself, and this is like a way to kind of gauge. All right, so is your practice ready for virtual support? Are calls regularly answered by voicemail, not a live person? Is voicemail answering, or if you have an answering service, that counts as voicemail to me. The next one is, are there verification delays? Are you noticing that? And the next one would be, does the owner have to step in on routine tasks all the time? And then as we go to the next one is, do new inquiries wait too long? Such as, I don't know if you have like a digital way of receiving of your leads, or do other providers just give you a phone call or send you an email? Does those inquiries wait too long before that first phone call happen? Are staff constantly being interrupted? And we're talking about this on a practice where you have your front desk receptionist, but they're trying to do all these different tasks. But while they're trying to verify assurance, they have a new patient walk in, so they have to put that to the side to handle that new patient. And then the next one would be another full-time hire feels too expensive. That's a big question, and that's why we have it labeled that way. But if it's 2 or more of these questions is yes for you, hit in that chat, yes, please. Hit in the chat, ready. And that tells us that you are ready for this virtual support that's going to really help your company. Next slide, please. All right, so one of the offers that we are offering is we are offering $1 for your first week of service. And the reason why we like to offer this offer is because we believe in our system so much that we know that once you get into the system, it's going to help your business. And with that $1, because we know that for that first week, you're going to have to train your VA. You're going to have to show them your processes. You're going to have to share SOPs with them. And so what we want to do is we want to take on a little bit of that cost of you onboarding your employee. So that's why our service is for $1 for the first week. And we are doing a drawing at the end of this that we're going to give $200 off to one particular business. And so we do want you to, hopefully some of the businesses will win that. But if you are ready to get started, we do have a QR code up here that you can just scan that QR code, and it is an actual order form that you will fill out, and we can get you started with that whole entire process. Again, our services, we're going to give you our first week of services for $1. Next page, please. All right, so this is my favorite part of the webinar. Is Q&A. This is an opportunity for you to ask any questions that you have. Myself, me being in the medical practice or the medical field for the last 15 years, I have a lot of information, or I got a lot of experience that I can share with how this can really help your business. And I would love to hear your ideas and how we can help support your business, because our goal is, again, to get you started with one VA, but as your business is scaling, to give you a ton of other VAs. All right, so do we have anyone that have any questions as of now?
Thanks so much for joining us, everybody. Please feel free to use the Q&A box to type in any of the questions that you might have been holding while Demario was speaking during the webinar. Otherwise, you can also use the chat, and we will attempt to redirect those questions to the Q&A box.
And also, as a reminder, we do have the QR code right there. So if you decide to move forward, you can go ahead and scan that QR code. Or if you have more questions, please put it in the chat. Or if you would like to go directly to speaking to a sales advisor, we can set that up for you as well.
We have a question, Demario. Somebody is asking what other topics the webinar might be able to cover, and or if we are offering other webinars for the future.
Yes, that's a amazing question. Other topics that we plan to talk about in other webinars would be billing. I think billing is very important. Also, more of insurance verification. I think that's another important seminar that we would do in the future. Also, another one is credentialing. I think credentialing is a top subject that a lot of providers don't understand. And also, the goal is always, if you're with VirtuAssist, we're gonna try to find solutions where you can save a lot of money. So maybe instead of hiring a out of office billing support person, let's figure out how to get billing done in house, where you're not paying a percentage to a billing service, but now you're saving a couple dollars by having that in house. So I think that's going to be a really good webinar that we're going to do. But ongoing for the next every 2 weeks on a consistent basis, we will have different topics. But also, we are welcome to hear your topics that you would like us to talk about as well.
And we have a second question, Demario. Are you HIPAA compliant?
Yes. So our agency is HIPAA compliant, and also we make sure that yourself and also our company sign a business association agreement that kind of lock in that HIPAA compliant part of things. So we will be completely HIPAA compliant and make sure. Also, another part of that will be we will make sure the VAs are maintaining that HIPAA compliancy. And if we ever notice anything that's out of order, we would alert you, because we do have systems in place to make sure that the HIPAA compliance is always being maintained.
Thank you, Demario. We have another question. How could a VA assist in providing crisis support of the 24/7 persuasion?
That's an amazing question. I like that question because we actually have that within our agency. So part of our agency, we do offer crisis support, and in a 24-hour basis, we do have someone that's able to answer a phone call. It's different levels of crisis. So when we talk about mobile crisis or 23-hour crisis, which I'm not sure what state you were in. I know every state has a different level, but having someone answer that phone during those hours. So think about 2 a.m. when a person is in crisis, to have someone to say, hey, answer those questions, but also verify assurance, but also give them the next steps of what needs to happen. If that means that they are coming to your office to come for evaluation, or if that means dispatching a mobile crisis team to them, so that's the beauty of having someone working 24 hours, and also the cost is a lot less than to have someone physically working 24 hours in the building, and you don't have to pay for office space and everything like that. But it works out really well. Our agency, we have someone on staff 24/7, even on the weekends. If someone calls and needs services, we are there for them.
Thank you, Demario. We have another question. What CRM or system manages all of this?
So we would use your system, and pretty much what we say is we provide the qualified VA to your company, or this will be your employee, but you will have to provide the system to them, because every agency uses a different type of CRMs. It's thousands of CRMs out here, and or we always call them EHR systems, but so we would use that, but you will have to train them. And that's why we use that first week for $1 for you to do all the initial training that you will need to do with your VA. We realize, that just like any other company, you do have to have, beyond that 1 week, you still will have to do ongoing training until they get to that point. But they will use all your systems to operate within, your systems.
Thank you, Demario. We have last two questions. The second to the last one is, how can a VA support something like a therapist practice, outpatient therapy?
Okay. Well, again, that's another service that we offer internally. Great question. So I would say the best part of that would be someone that's handling the intake. So if you have a person that can answer the phone and say, hey, I'm with this practice, and they can verify insurance for you and put them on your schedule and manage your schedule. So if you have cancellations, notifying you of cancellations, also doing different things as far as retention. So making sure that those clients are being retained. Also collecting copays. I know that's a good task, but making sure those copays are being collected. Also doing things such as surveys, making sure the clients are happy. Also, one thing that I noticed that works out really well, if you have multiple providers that's within your practice, they can work with those different providers and maintain all those different tasks.
Awesome. And then our last question, how long does it typically take before I get matched with a VA?
So right now, because we are in a very busy period, it is going to take about 2 to 3 weeks, but it's a pretty quick turnaround time. However, those steps to get you ready starts right away. So sometimes, depending on the availability, we may start matching you with candidates, within a week and a half.
Okay, that wraps up all of our questions. Thanks so much, Demar. I think we're ready for the drawing now.
Okay. And thank you guys for attending. Let's go to the drawing.
All right. Our winner is Freddie Jackson. Congratulations, Freddie.
All right. And congratulations, Freddie. Thank you for attending. Well, thank you guys again for attending this webinar. I'm happy to share this information, and I hope to see you guys in future webinars, because we're going to be going through a lot of different topics. Again, if you want to share other topics that you guys would like us to go over, we would love to share that, and also ways that we can help your business scale. Thank you. Have a wonderful rest of your day.
Thank you so much, everybody.